People often say Rwandans enjoy comic, light, and unserious content. We refuse to believe that. The Voices podcast is here to help you get all the information you need if you are one of those people that are interested in informative, educative, and inspirational content. The Voices podcast is hosted by Arafat. We're here to give you all the information that you've been yearning to get in Rwanda. If you're one of those people, then welcome to the Voices podcast. Yeah, the Voices podcast. So we just mentioned it that when someone comes, you first of all look at what kind of person is this one? What can I do about them? Apart from just what they desire. Because, you know, someone comes with intentions and what they want to, the outcome of what they're going to get from your surgery. But your case is that you have to first see what you can do. Moment where you see there's nothing you can do.
Except only when it only happens when their expectations are not realistic. Because if a patient comes in with unrealistic expectations, let's say, you know, in social media, social media is filled with filters. People will have will post a picture with
really?
filters, and then your patient will come in telling you, I want this face, I want to look like this. But you will see that those are mostly filters. But then you tell them, you try to be realistic, at least. You put a mirror in front of them. And then you try to, if it's a facelift, you try to pull. You try to pull up and show them, okay, if we pull like this, this is...
Hello, everyone. Thank you so much once again for joining me at the Voices podcast. My name is Arafat. Today, we are speaking about, reconstructive surgery. Today, we are talking about butt lifting, or BBL, or the Brazilian butt lifting. We're talking about facelifting. And of course, we are looking at reconstructive surgery in general. And to talk more about that, I am joined by one of the leading reconstructive surgeons, or people who are really doing this work greatly in Rwanda. Today I'm joined by Dr. Fidel Simba. Is it?
Yes.
Dr. Fidel Simba, who is a reconstructive surgeon and a plastic surgeon in Rwanda. He's doing this work. It's his daily work, and that's what he does on a daily basis. So today he joins us really to dive deeper into the conversation of facelifting, butt lifting, and of course, why you should be doing it. So, Doctor, good afternoon, first of all, before I ask you. I mean, the question is burning, but I wanted to first ask the question, but let me first greet you. Good afternoon.
Good afternoon, Arafat.
How are you doing?
I'm good.
You doing well?
Yes, I'm doing great. I'm happy to be here.
You happy
Finally.
Of course, it's not been easy. I know you're doing a lot of work. I think a lot is to do with reconstruction as well.
Yes.
Today, I really, I felt like I wanted us to have a conversation on reconstructive surgery, but focusing on butt lifting, the Brazilian butt lifting. It's a trending topic, not only online, but it's everywhere, even in Kigali. We've seen that so many young women, I mean it, they really want to have this, beautify themselves beyond what they were born with. Having that trend, and I think much is also due to access to, what is happening around the world with social media, and with a lot of content that is really on social media about that. But they tend not to know really how the process goes. Yes. So we hear more about facial lifting or facelifting, but we don't know about it. To someone who really watching us out there, who hears about reconstructive surgery and they don't know what it is, who hear about plastic surgery and they don't know what it is, what would you tell them before we dive deeper into facelifting or other topics?
It's an interesting thing, and thank you for bringing it up. Plastic surgery is it's quite a wide field, and it incorporates reconstruction, and aesthetic surgery. So it has those two main.
Aesthetic surgery and reconstructive.
Aesthetic is cosmetic surgery.
Cosmetic surgery.
Yeah, the facelifts you were talking about, BBLs. And then reconstruction deals with, restoring shape or form and also function, basically. That happens mostly, we do that for most patients who, it's actually the most common one, most common procedures that we do. And it's...
Can you get closer to the microphone maybe a bit? Okay.
Yeah.
Sure.
It's the most common procedure that we do. So the most
The reconstruction.
the reconstructive reconstructions. So we do reconstructions for burns, patients who've had burns, patients who've had trauma, like road traffic accidents.
Road traffic accident.
Or cuts or anything. And then for also congenital defects, people who are born with different malformations, especially on the outside. And also
like
cancer.
the malformations, so you talk about for instance...
Cleft.
Clefts, okay,
Yeah,
clefts, I know clefts.
Cleft
Okay.
palates, maybe deformities on the hands, yeah, like multiple digits, fused fingers, things like that.
So you're the people who do that as well?
Yes.
Okay.
So, and also cancer, oncologic surgeries, when someone has a bad tumor, either on the face, on the anywhere on the body, and then after removing the tumor, that defect that is left, you try to, we cover it, we restore shape and function. So if it's on the face and they remove the tumor, instead of someone leaving that person with a deformed face, we are the ones who come in and restore that shape. Yeah.
Also, for instance, so someone has had a breast surgery or maybe breast cut due to breast cancer or even any other disease.
Yes.
So you're the ones who come after and then reconstruct this area and then turn it into,
we give them another breast.
You give
a shape of a breast.
Oh, wow.
Yeah. And that whole part, that whole field is reconstruction. That was actually the beginning of plastic surgery. So the whole history started, plastic surgery became famous in the World War when, soldiers needed to be reconstructed from burns and facial injuries. So that's when plastic surgery really boomed. But it started way back, in the years before Christ.
Really?
In India, there are some stories, it's written about nose reconstructions where, the oldest reconstruction of the face was on the nose, where they had to...
Why so?
In India, there was a culture of, if they caught a thief, they would cut their nose or even their lip. And then one of their medical doctors at that time, the traditional doctors, tried to come up with ways to restore shape on the nose. So that's how plastic surgery started. That's actually, he's actually considered as one of the first people who performed plastic surgery. But then it became famous during the World War. So that's basically reconstruction. It plays a big part. And then the aesthetic part came up, you use your skills in reconstruction to do your aesthetic procedures. So it's all about reconstruction. So if someone wants to look younger, because you know how the body works, how your body is formed, and the changes that have happened. So it's more like you're reconstructing the face and making it look younger. So that's how all these cosmetic procedures came up. They all came up from, the reconstructive procedures. So that's why there's an interesting saying that a good aesthetic surgeon is a good reconstructive surgeon. So you need to know
reconstruction before
you do your cosmetic thing. So if you're good with your reconstructions, then
you're going to be
good at your aesthetics. Yeah,
or the cosmetic.
Or the cosmetic, if I can say. Because those are the skills you're going to bring in. Yeah. And the most interesting thing about plastic is that there's nothing, it's nothing like straightforward. The doctor, your surgeon, plays a role as an artist. He'll have like different ways of, he'll say, yeah, okay, I want to do it. Patients are different. Even though, let's say you're doing a breast, breast reconstruction or something, a breast lift, for example. Patients are different. So if you've received one patient today, it will be different from the patient tomorrow. So the way they appear will make you, play around with your skills and also the art. And then you know what you want to achieve. And then that's when you'll design your final results as you want it to be. So basically, plastic surgery is more of reconstruction, and then the aesthetic part also comes in. So most people don't really know what we do. But right now this is now the time when they're starting to understand exactly what we do. Even in hospital, you find that you'll see a patient who's going to be seen by another doctor, another surgeon, and you know very well that patient is going to come to you, but they've sent them to someone else because they don't know that that's actually in your field. Yeah, so people are starting to understand.
Tell us, what are some of the cases that, okay, that's really a good example. Maybe we'll be even educating some doctors out there or, people who receive patients. What are some of the cases that you see that they send a patient, as you just mentioned, that they might send a patient to another doctor for consultation or for, diagnosis, yet it's a field that really you'll see that you're the right person to really see this person? What are some of those cases that they end up coming to you, but at the start, even the people at the reception, if people are receiving patients, they don't know that this is the case that really is in our field of reconstruction.
Yeah, of reconstruction. Some of the cases, well, let's say like a tumor on the face, for example. Even if it's a benign tumor, it's a lump on the face. They'll send it to a surgeon, like maybe a general surgeon. And then because the face is a very sensitive area, people don't want scars. They don't want scars that are very visible, And then because sometimes the general surgeon will realize that, yes, this is a mass on the face. It's a tumor on the face. And the best for the best results, I would rather have a plastic surgeon do it. And then they end up coming to you. So that's just a simple example, but there are so many.
Sure.
But basically, what I've been telling people is that we deal with anything from head to toe.
I see.
On the surface. From head.
You're the one spraying with the upper area.
The outside part.
The outside part of the body.
Yes, we do a lot on that.
So if someone asks you that, tell us the process of someone getting to your consultation room to the process of coming up with a final result of a facelift. Let's talk to someone who is imagining how someone really reconstruct my face into a young person's face or into a young face. Like you just mentioned earlier that some people can wish to look younger, but they know their age.
Yes.
You are 50 or 60, but you want a 25, look. How do you do that? Because these scars, removing scars and all that. Tell us the process of consultation, guiding this patient, and what you consider for you to go on and do the reconstruction or the plastic surgery on this person, and what might end up making you not do it to this patient.
Okay. So it always starts with, when a patient comes in, the first thing you see or you notice, maybe on the spot, it's their age. You can tell. sometimes when someone is elderly, they're young, so you can tell. So depending on their age, you can have an idea of how, the changes that have happened. So when they come to you initially, they come with a request. They have something they want. They will present with, let's say, telling you, okay, my face looks old. I have lines in my face. I have wrinkles. We call these jowls. Wrinkles down here, the neck. On your neck, you have all these
falling skin.
Yeah, the sagging skin and all that. So you always ask them what they want to achieve. So you always start with, wanting to know what they really want to achieve. So some patients present with realistic, expectations, what they expect to get. Others come with unrealistic expectations. But in general, you give them options. So let's say if we're talking about the face, there are so many ways of approaching it. We have facelifts, as you started mentioning, but facelifts are usually surgical. Yeah, it's more surgical, and we also have non-surgical methods.
We'll talk about that.
That in
details. Yeah.
So it all comes to the age of the patient. So there's something that happens with our bodies with age, and it's something natural. You cannot change that. When you age, the volume in your face, your face loses volume. And also the strength or the collagen of your skin and the tissues become a bit loose. So things start falling. Everything starts falling down. That's why you'll find older people with the sagging skin. Or when you look at them, they'll have so many lines. But younger people, their faces are full. They are tighter. Their skin is really tight. You won't see visible wrinkles on a young person because they are still young and their collagen is still intact. So when
the collagen is the hormone. Is it what is collagen? I mean, to someone who doesn't know that.
Okay, collagen. These are structures in the body that hold, in simple words, that hold our structures together.
Okay.
Especially in the skin, we have a lot of collagen in the dermis. Yeah, and also we'll have some in muscles and so on. So as people get older, they tend to start losing this component in their body, and then that's when they start losing the strength of the structures that are holding everything together. It starts becoming loose. It happens with age. You can't
avoid it.
You can't avoid it. It's coming.
It's inevitable.
It's inevitable. So you lose volume. With volume, it involves fat of your body. We have fat in our cheeks. We have fat up in temporal areas, but mostly in our cheeks around. And then when you start losing that fat and you're losing that volume, that's when your face starts changing. And then you'll start having all those wrinkles, So to address this, usually you'll have to look at, at what rate is my patient, having all these saggy skin or the wrinkles, or what rate is it? Is it mild? Is it moderate? Or is it severe? Then from there you can easily determine what kind of approach you're going to give them. And
of course, what level of reduction can you do about them? Like if you are to reduce them, maybe to turn this face back to a bit younger, you can't as well turn it to someone who is mid-moderate, going to maybe
you can't take them from. You can't take them from if someone is like 60.
You can't take them to 40.
You can make them look younger, but Yeah, 40. You can't take them even to 30. Some things you can't change, but
But
at
maybe
least
around 40, 45.
yeah, or even 50 sharp.
Yeah. But someone might come and say, I'm 60, but I want 35 or 30.
You can even come with a picture.
What are you
Instagram.
talking about?
But basically, here, when they come with that, you give them mostly
A realistic,
realistic
response.
responses. But the most common thing that we see here in Rwanda, usually people don't really do so much on the face. Rwandans are really okay with the face, but it usually happens with the younger people between 30 and 45.
Oh, really?
Those are the ones who when they start noticing the changes that are happening, they come for some skin tightening procedures because the sagging is mild. We call it mild to moderate. So for them, an actual facelift is not appropriate for them. Those are the ones who will need the non-surgical methods.
Okay.
That would address those.
So in Rwanda, you just mentioned it that most people who are coming for facelifts are one in 30 to 45. 30 years
Those
to
who
40.
want face work.
They don't
like something on
really?
the face. Yeah.
But not older people.
The older people, it's
they're
not,
like,
it's
it's
not
okay.
that common. It's not that common. But it's coming up. It will come. Maybe in the next few years it will come. But you find that our people are we are so reserved.
Very reserved.
Very reserved. And especially when it comes to these procedures, we are so reserved. So you reach a point where, most of even our elderly people, they find pride in, being a senior citizen and looking like a senior citizen.
Yeah.
So
which is only common here.
Yeah, and it's actually good because it's our culture. We respect them. Yeah. So you won't find so many old people coming for facelifts and so on. But I'm sure that is coming up because Rwanda is also, everything around is, affecting us in one way or another because of social media, modernity, because, social media has really played
the changing world, of course.
the changing world.
Everything is really
social
changing.
media has really played a big role in this field of ours, especially,
Facelifting and all that, aesthetic.
Yeah, aesthetic surgeries. So you won't see so many people doing that. But it also depends on, I think, societies and cultures. Like here in Rwanda, you rarely see people coming for let's say a nose rhinoplasty, a nose job, or something to do with the lips. It will be rare.
It will be rare.
But you'll find that, let's say in other parts of the continent, or maybe in other parts of the world, let's say in Asia, you'll find that people are doing a lot of face work, facelifts, nose jobs, rhinoplasty, lips, and all that. So it varies from one place to another.
So you just mentioned it that when someone comes, you first of all look at what kind of person is this one? What can I do about them? Apart from just what they desire. Because, someone comes with intentions and what they want to, the outcome of what they're going to get from your surgery. But your case is that you have to first see what you can do. Is there a moment where you see there's nothing you can do?
Except it only happens when their expectations are not realistic. Because if a patient comes in with unrealistic expectations, let's say, in social media, social media is filled with filters. People will post a picture with
really?
filters, and then your patient will come in telling you, I want this face, I want to look like this. But you will see that those are mostly filters. But then you tell them, you try to be realistic, at least. You put a mirror in front of them, and then you try to, if it's a facelift, you try to pull. You try to pull up and show them, okay, if we pull like this is how your final result will be. And then they have an idea. And then, it always associates with different procedures. So you try to give your patient your best. So I always say that I'll give my patient the best that I can, okay, that I can give them. And I'll do the best so that they can get the best result. But sometimes when you see that what they're expecting or what they really want is not something you can really deliver, or it's not really realistic, you should tell them, and maybe tell them to consult somewhere else. But what we try to do is we try to talk to our patients and be open, and then we lay everything down. Yeah, we lay everything down and tell them, you want this, but in actual sense, this is what should be done.
Can achieve.
Yeah, this is what you can achieve, and then you go through the whole process. And then
so after the patient has come, after you've done all that, after you've analyzed the patient, after you've shown them exactly what they can achieve, and let's say they accept, what is the next step? Do you start with drawing the face? Do you start with, what is it that goes on from there?
Before...
Let's say we are speaking now if someone is going to do a non-surgical, and speak about when you're going to do non-surgical and when you're going to do surgical.
Okay, so before even doing all that, we are clinicians as plastic surgeons. We are doctors, so we assess the patient as a whole. So if you after talking to the patient and getting to know what they really want, what brings them to you, you need to ask them about their general health in general. Need to know if they have any other conditions, if they have any chronic illnesses, if they are on any medications, if they are smokers, if they smoke anything, or if they are taking any illicit drugs, which can really affect your results, and also if they have any conditions that can affect the anesthesia that will be given to them. Here you're trying to play it safe. You're trying to play it safe as a doctor because you don't want any complications, and you want your patient to be as safe as possible. So you need to know the general status of your patient. Yeah, so that's when you
do multiple tests.
We start running tests. We do physical examinations, and then we take them to the lab, and then everything else follows that. And then after all that, when you've come to realize that, let's say it's a patient who is fit for your procedure, then that's when you schedule a date. They can't come on that day and you perform the surgery on that very day, because you need to plan them. Sometimes you have other patients, but even if you may not have a list of patients, but it's not a case you can immediately do at that time. So you need to schedule. So you plan a date with the patient, a date when they'll be comfortable to have it done, and a date that you feel comfortable or according to your schedule that you can work on. And then you'll also have the anesthesia team visit them.
So is it a must that for any plastic surgery that they have to be given anesthesia?
Depending on the procedure that will be done.
So there are some that don't require to be given that?
For example, you mentioned some non-surgical, procedures, which involve fillers, dermal fillers. We call it dermal fillers, Botox injections, stuff like that, where you know that you don't really need to give any anesthesia. And then anesthesia usually has different types. So we have general anesthesia where they put you down to sleep, and then we have local anesthesia. So right now the world is evolving; it's going towards more of local anesthesia, like the current trend. But general anesthesia is really safe as well. So if a patient is going to undergo, let's say, a general anesthesia procedure, they'll need to be seen by the anesthesia team. And if it's a local anesthesia as well, yeah, you need to rule out any complications. Yeah. So when you've done all that, then that's when you plan your date of surgery. And in cosmetic surgery, always, of course, you need to tell the patient what to expect in terms of how much money they're going to pay.
Sure.
But
I mean, it's a luxury surgery, so it must be really expensive.
yeah, it's quite costly. But yeah, patients who come, they usually come when they've done their research. Most of these patients do their research very well. They do their research on the surgeon, they do their research on the procedure. So they'll come to you knowing everything. With internet.
It's like we are here for you to do your job, but we know
yes, but we know what to expect. We know what you're going to do. We know what you're going to cut, and then everything comes. When you're explaining everything to them, that's when you realize that this person actually did some research. And I really commend my patients who come when they've done their research very well. I love that because it shows that you're ready. You've done enough research. It's just like someone who wants to buy a house. You need to inquire. You need to know what materials. Because it's your body. You're going to work.
It's your body.
It's your own body. You need to do your research on that place or the house you're going to build. Or if it's a car, you need to investigate it. To know exactly. You won't just engage into getting it. Or buying it without doing your research. So it's the same thing with the patients who come. It's always good to first do, your research in all those things. So then surgery comes, the day of surgery, you do your surgery, and then you explain. But before that, you need to explain to the patient. We explain to the patients what to expect after surgery. After surgery, you'll explain the complications or even what to expect with your body. Because when you do a surgery on someone, your body undergoes different changes,
Sure.
Because there is inflammation that starts.
It's surgery like any other.
Yeah, it's surgery like any other. So you'll tell them that they'll expect swelling. That is one. They will expect, the first few days to have pain. They'll feel pain. But with all this, because you're the one who is treating them, all those things, all those problems or the consequences of the surgery. So you try to help your patient, give them pain meds, you give them medications that can help them feel better. But then you need to explain to them that the swelling will be there for the first week or even 2 weeks, but then it will start going down. Because the swelling, when they get swollen up, sometimes it doesn't look like it really looks bad.
It's like it's even bad than the face they had before.
They look really bad, but then with time they start seeing the final results showing up, and that's when they become happy. And then you also explain to them, all the risks, the complications that can occur.
Let's not talk about the lyrics now. I want us to, because that's something really we are coming to, but I want us to look at, you talked about pain that comes up with the surgery. You talked about how they should be aware that what they're doing is really risky in one way or the other. But you continue to see people coming for that. Seriously, if you would really be honest with me, what are some of the main reasons that are convincing? You're a doctor and you're working for money, of course. And this is your job. You've learned it because you want to really serve people who want that need, who have that need, sorry. And what are some of the genuine reasons that they give you that really think they're worth it going for to do the surgery, especially the plastic or the cosmetic?
Well, it's the genuine reasons for aesthetic surgeries are usually for them to look better. It's more. It has a lot to do with their how they see themselves. So, cosmetic surgery plays a big role in boosting one's confidence. So when they've started recovering, let's talk about the patients who've already been done. When they've recovered and they're seeing their final results, those are the patients who actually tell the other people. They refer other patients to you because they ignore what they went through, because the final results are way better than the pain they went through. Yeah, or even the whole process that they went through. But most of the times the pain is not that much because we give them painkillers. You know, it's not like they're really in pain. No, we give them painkillers and they really feel comfortable. Most of the patients even sometimes they tell you, hey, I'm feeling really fine. I'm just worried about the swelling. The only thing that we can't really change or we can't work on is the swelling. That's a process your body is going to go through. But then after that, the swelling goes down. You know it's going to go down. But at least the pain, it's something we can work on. We give you pain meds, strong pain meds, and it really puts down the pain. It knocks down the pain. And our patients report like very mild pain, which is really bearable. And that's why they still come. They always come. So the main reason is mostly the appearance, how they appear, and how they want to look. It plays a big role with their confidence. So they come to you and tell you, okay, I'm not happy with
how I look.
I'm not happy when I take off my shirt, my clothes. I'm not happy with my tummy. You know, I'm not happy with different parts of the body. So that's...
You do tummy reduction as well?
Yes. We do tummy tucks, liposuctions, work on the breasts. Yeah, anything. Even the arms. Ladies have these sagging big arms. You know. Yeah, so we work on those by just doing lipo or even cutting, reducing it, what we call brachioplasty. So our patients usually come. The main reason why they come is that they are not happy with how they look, and some of the changes that happen with the body. You know, I'm trying to stick to the face because that's where we are still talking about.
Yeah, we are still on that.
On the face. So they come talking about things, parts of their body that they're not happy with. If it's on the face, they're not happy with the wrinkles. They're not happy with certain lines that start coming with age. And those are the things that you start addressing. And of course, there are certain things that you see that they need to work on, but if it's not bothering them, you just mention it, but if they don't want you to work on that, you can leave it. So that's when you start now taking them into different options, the non-surgical if they're young. So basically...
So what are some of the actually talk about that, what are some of the non-surgical procedures that you usually, that you've really even recommended to some of your patients that you told them, you don't need to go into surgery. You can repair this by doing this. What are some of those cases, or have you handled some cases? You can give us examples.
Yeah. Let's say people who come in with, we're still on the face, let's say.
Sure.
Yeah. It's a young lady, 40 years, okay, with some wrinkles around the eyes, what we call crow's feet, or even on the forehead, and they feel like maybe something can be done. But we have different procedures that can be done, that are done for that. If someone is...
That are surgical.
That are non-surgical. Yeah, that are non-surgical. If you can give them Botox injections. You can give them dermal fillers. It depending on what you really want to achieve.
So Botox injections are
Botox injections are more like they paralyze muscles. Botox it's like a we call them neuromodulators. So they paralyze the muscles, especially on the forehead and around your eyes. And when you paralyze these, because all the wrinkles you see on your forehead when you do this, this is your muscle that is pulling. Okay, so if you paralyze that muscle, you won't be able to do this. So the wrinkles won't show.
Even when you do like this,
Yeah, when you give.
Can you see mine?
Yes, I can see yours.
So if you paralyze them, if I do like this, they can't come.
It won't go up.
What impact does that have on my body? If you're to be realistic and really honest.
The positive ones?
The positive and negative ones.
Okay. The positive ones is it will make you look better. Okay? If it's done by a professional, it will make you look better. Because you see, these wrinkles, sometimes you frown without knowing. Because let's say if you're walking under the sun, you'll tend to be like this, and then you're frowning already. But then if you paralyze those muscles, your skin will stop wrinkling, and then your skin will start stretching with time. That's how the wrinkles disappear, because your muscles are no longer pulling and causing those wrinkles. So your skin will have enough time to heal and stretch enough. So that's the magic of Botox. But then maybe the negative part is it's something that happens, and
you wanted to skip it.
No, I can't skip it. I wish I could, but it's always good to be open.
I mean, that's really good.
Yeah. So everything has its complications, its downside. That's why I always encourage people to consult a professional in this field. It's either for non-surgical, it's either a plastic surgeon or a dermatologist. Yeah. So anyone else who try to inject, sometimes they've done some courses and they can do it, yes, but it's always good to have it done by someone
a specialized
who knows
physician
who knows the risks and who knows the anatomy very well. So sometimes you might inject the wrong muscle, and if you're not sure of your anatomy, you might inject the muscle and cause, let's say, and your patient won't be able to lift, like open their eyes, because the muscle that helps in opening the eyes has been paralyzed.
Let's assume you've really injected the right muscle. I'm trying to understand, because there's a reason we are created to have that face that can fold, and and you can see everything on the face when someone, like everything that happens to someone who has not done that. I think there is a reason as to why it's like that. Because it's not a disease, it's not a malfunction, it's natural.
Yes.
So I want to know, I mean, what are some of this negative? Because you talked about the positive, but what is the negative part? Because it gives you now good results, I agree. But is there anything that is negative after you've done it?
That's why you need to do your assessment ahead of time. So when you're reviewing your patient, you need to see if they have any other neurological deficits that are affecting, let's say, their eye opening. So some people use these muscles to open their eyes.
Sure.
Yeah, like because of maybe some problems they were born with, or maybe let's say they've had a sort of paralysis before, or some of them were born with a condition that causes muscle weakness. So you need to assess properly that the patient that the patient is a good candidate for that before you inject. So if let's say you realize that your patient uses these muscles to keep their eyes open, if you paralyze them, then they'll have trouble with opening. You need to be sure of that. That's why we do a pre-op assessment, clinical assessment. You need to know that your patient that's the best patient for that, and we rule out all those issues. You mentioned that it's a natural thing that happens, but yes, it's a natural thing. But people, you end up not not liking how you're changing. You know, it happens with time. So the more you age, you're not happy with the the changes that are happening in your body. So that's why you consult. It's natural. Just like people have a right. It's really okay to feel like you're not happy with how you look. That's why people hit the gym. You go to the gym,
you hit the gym
because you look at yourself, you look at your belly, and you say, "Hey, I need to work on this.
Yeah, sure.
I need a six-pack, or I need arms. I need to work out. I need to look, fit. Yeah, it's all about working on your confidence or your self-image. So it's a natural process, but again, it's something people don't tend to like. So if you're not happy with how the changes are happening, you come to us. We give you the options that are there, and we try to help you in a very realistic way. Yeah.
So combining the facelifts and non-surgical and surgical that you've performed so far, are the numbers increasing? Can you come up with? Do you have some numbers that people you remember you've worked on so far that have done that in the country?
Not really. I've done a brow lift. It's like an upper face lift here, and some other procedures around the eyes. But the numbers are not that much. But I know some of my colleagues have done.
Yeah, you can see that.
Yes.
You hear them. They tell you that
they've done a few cases.
So
there are not so many. That's
so
why
how
I told
many in
you.
the country that can do that? How many professionals do we have in?
So far we are 7 plastic surgeons, but one is not around. He went for a fellowship. So we are 6, and among the 6 currently around right now, 6. Currently.
So before we leave facelift, I want us to understand. As a surgeon who is an expert in this, how do you help patients manage their expectations in this? Because we've literally, talked about it a bit on how to manage that. But is there a unique way how you convince patients that what you expect is really impossible, even if you go to someone else? How do you manage patients not to think beyond what they can get?
Okay.
Apart from just looking at it in the form of just getting money from this patient. Let's be clear here. Because it also comes with professionalism and ethics and humanity.
Yes.
When you're doing this.
So with the current trend that is there, as I always say, the internet has really transformed a lot of things. And with AI being present, we were talking about AI earlier, and you find that most of the pictures we see online, they're really,
fake pictures. They're fake.
They were worked on by AI filters and all that.
They're filtered pictures.
Filtered pictures.
It's hard to find an unfiltered picture for sure online.
The jokes we always say that if you want to date a girl, take her to the pool. Or you'll see her properly. Anyways, when a patient comes in and they show you a certain what they want, because most of them will show you pictures, they'll show you videos, let's say another surgeon.
Oh, really?
Actually,
for me, I'm really innocent about this. I thought they come and say, "Doctor, I want this. Tell me how it can come out."
Hey, they know what they want. Oh. These patients know what they want. Our patients know what they want, which is really good. I like that because it helps you convince them. It helps you, talk to them and get to a common ground with them. So when a patient comes in and let's say they show you, let's say, a video from a surgeon from the US because here in Rwanda we don't really post a lot. We don't do a lot of.
You don't even post.
We don't do.
You know,
We don't.
you don't even post.
We don't do a lot of before and afters. So
have you done even one before? You can show us maybe later.
Patients. It's not ethical.
I mean, you will get consent maybe from them. I mean, no, they can't even give it to you.
With time. With time,
yeah.
So when they show you those before and afters from other places, sometimes you just try to talk to them and tell them what is doable, what is not doable. Some things are not realistic. So what you try to do, a good surgeon needs to protect his patients from this social media thing, this the pressure of wanting. You try, it's a very marketable and a growing field, but sometimes you need to be realistic with your patients and tell them what to expect. And all of them, most of them, get to understand that yes, maybe this is not realistic, but what is realistic is also really good. I can go with that. So you end up going on, and you get and you provide the service. Yeah. So as you were asking about, how do I handle that, and if I have
because also you have pressure of money.
Yeah, you need to. Yeah,
you need to work.
You need to work, course. But you try to protect your patients, because that's your role. You give them the best of what they can get. You make sure that you what you're going to do for them is safe for them, and the outcome is what they really want to get. And if it's something that is beyond, let's say, your capacity or your skills, you know a colleague who is able to do that, so you can easily refer them there. So as for me personally, I don't do a lot of face, but I know a colleague who does more. So if I get a patient who needs a lot of face work, I'll just say, okay, I have a colleague who can do that. We can easily go there. I just refer them. So that's the way of being ethical and more professional.
So is there any challenge you've had, or you've noticed, or you've heard from maybe your colleagues that came out from facelifting, where maybe one patient had that surgery but it didn't turn out well, and what are some of the causes and how it was handled?
No, not really, because I told you we haven't really done so many. So the ones around, but then not so many difficulties, no complications so far. I haven't had, but complications are documented, but so far no complications around.